Are we good? Good afternoon, everyone, or good morning, depending on where you're joining us from today. My name is Chief Beverly Cook. I'm from the St. Regis Mohawk Tribe and a board member of the National Indian Health Board and Nashville Area Representative. It's my pleasure to welcome you to this Ask Me Anything event today. Our conversation will focus on the currently available COVID-19 vaccines and variants of concern. If you are unfamiliar with AMAs, they are a time where you are able to ask the subject matter expert any questions you may have about a certain topic. Since today's focus is on COVID-19 vaccines and variants, we will limit questions to these topics only. If you have any recommendations for other AMA topics you'd like to see in the future, please feel free to type them in the chat box or send an email to Darby Gallagher at DGALLIGHER@NIHB.org. Her email is also in the chat box. Today, I'd like to welcome Captain Holly Van Loo from the Indian Health Service. She will be answering your questions during today's AMA. I'll now turn it over to Captain Van Loo for a brief introduction and remarks.
Hi, good afternoon, everyone. Thanks so much for asking me to join. I really appreciate the opportunity to answer questions regarding vaccines and COVID-19. I have been a little under the weather, so apologies. I sound a little froggish today, but I'll try my best. I work for the IHS as a pharmacist. I have been stationed at the Phoenix Indian Medical Center for the last 15 years and have been recently, for the last year, working on the COVID-19 vaccine response, helped to create the IHS Vaccine Task Force when we were notified that we were going to get our own vaccine allotment to distribute across Indian country to those sites that chose to go with the Indian Health Service for vaccine distribution. So I'm a pharmacist. I administer vaccines on a regular basis. I have a husband and 2 kids and a very troublesome puppy, but I'm excited to be able to answer any questions for you today. I love the topic of vaccines. I'm very passionate about the information, and I'll try my best to answer the questions you come forward with. So thanks so much for the opportunity.
Thank you, Captain Van Loo. We're happy to have you here to help us today. Again, thank you everyone for joining us this afternoon. I'll start with questions that were submitted online. And once we get through those, we can move on to questions from the audience. When the time comes, if you would like to speak, we ask that you click the raise hand button and an NIHB staff will unmute you and you can comment. We ask that you please start by sharing your name, title, and tribal affiliation or organization. Once you're unmuted, we'd like to invite you to turn your camera on if you would like, so that we can see you while you are speaking. You may also type your question into the Q&A box. One of the first questions that had come in was, what makes the Omicron variant so different from the other variants? And don't we get new COVID-19 variants all the time?
That's a really great question. I'll do my best. My impression is that variants do occur all the time. They can occur. It's just really an error in the virus when it goes to replicate or make more copies, and when it jumps from person to person. And there have been a number of different variants, over a dozen, that have been identified. The Omicron variant is a little bit different because it has a number of different changes in what they call the spike protein, which is the outer coating of the virus. So it has a large number of changes there, which means that there was concern that maybe the vaccines wouldn't work as well, or our treatments that we had identified that were effective for other the COVID from 2020 or the Delta variant, there was concern that the treatments may not work as well. And more data and information is coming forward about what treatments have the best opportunity to work and offer the best protection. And we do know that the vaccines are still quite effective against the Omicron variant. So we'll talk more about the recommendations and boosters and those pieces, I'm sure, throughout the session today. But definitely the vaccines are still very effective against the Omicron variant. We just know that the Omicron is so incredibly contagious. It depends on which source you use, but essentially it can be 20 up to 70 times more infective than the original COVID virus that was identified, and far more effective than the Delta virus or variant. So it's important to use all of our measures that we have in hand, not just vaccines, having the opportunity to have treatments, but also mask wearing, hand hygiene, staying away from crowds, because it is just so highly transmissible.
Thank you for that. Do we know yet whether fully vaccinated means 2 vaccines or 3 at this point?
That's a really great question, and it's come up a lot lately. The CDC has clarified some definitions. So very recently, the definition of fully vaccinated has remained the same. And that means if you've had 2 doses of the Pfizer or Moderna vaccine, the 2-dose, what they call primary series, those first 2 doses you get, would be considered fully vaccinated, or a single dose of the J&J or Janssen vaccine, though that would be considered fully vaccinated. However, new changes have come through recently about boosters. So I would love to talk about that a moment, because some new terminology is coming forward. So right now, as of last week, it's currently recommended for anyone 12 and older to get a booster if it's been more than 5 months after your Pfizer or Moderna vaccine, or more than 2 months after receiving the J&J or Janssen vaccine. So those time points are important, but if you get boosted, then at that point you're considered up to date. So we have fully vaccinated, and then if you get your booster, you're now considered up to date. So those are the 2 terminologies going on right now.
Great, thank you. Okay, so what are you hearing, or are you hearing anything yet about a 4th vaccine if we've already had our 2 primaries and a booster?
Great question. There's, only time will tell. I think right now there are some studies ongoing in Israel. The US has followed a lot of the studies and the data that have been collected in Israel. Israel is a very highly vaccinated population. They've implemented boosters and now a 2nd round of boosters. So only time will tell. We don't know if additional boosters will be recommended. We just know that right now, with the current information we have, boosters are recommended for everyone 12 and older. And then for general vaccine recommendations, it is recommended that everyone should be vaccinated if you're 5 and older.
Okay. Thank you. Now, the next question is, once infected with COVID, how long does your natural immunity last, or do we know?
That's a great question, and I'm not sure if I'm the best person to answer this. There's been a lot of studies. COVID natural infection depends on when you were infected and with what type, for sure, whether you got it during the early phases of COVID, during the Delta surge, or now Omicron. So there are definitely ongoing studies. They think that you may have a decent amount of protection for about 3 months or so. I don't know the reality of Omicron because it's just so new. It's only really been in our country for about a month now. So we don't know the realities about Omicron and duration of protection. But in general, you would say you'd probably have some higher level of immunity after natural infection for the first 3 months after being sick. That doesn't mean it goes down to 0 after 3 months. And really, having disease or having COVID in the past and enhancing it with your immunity with vaccination is really ideal. People who have had COVID in the past and are vaccinated have much better coverage and protection, even against Omicron. So that's really exciting to have the opportunity to offer both natural infection plus vaccination. And you can be vaccinated if you've had COVID. You can be vaccinated as soon as you're out of isolation, as soon as you feel healthy enough and are no longer contagious. You could go receive vaccination.
That's good to know. Next question is it okay for an employee infected with COVID to return back to work without a negative COVID test? And what would be the guidelines to this?
Oh, goodness, this is a really complicated one. Thanks for this question. I don't know if I can adequately do this question justice because things have been changing so much. In the last week, there was a CDC discussion and a presentation just the other day talking about healthcare workers and non-healthcare workers and isolation and quarantine time periods. And it really depends on whether you're vaccinated, fully vaccinated, if you're up to date with vaccination, including your booster, or if you're unvaccinated in the definitions. So I would encourage you to work with your human resources and your employee health group to determine what they're determining as safe for return to work. There are a lot of different caveats right now, and even the CDC guidance can be a little bit confusing at times, and that's what we saw on a webinar just the other day. So I don't know the specific scenario, and I don't want to misrepresent information. So I'd encourage you to go to the CDC guidance for healthcare providers. Some of that new guidance does say you can isolate for 5 days. There are opportunities for you to have a negative test and to possibly return to work not too long after that time period, but I would defer to your healthcare facility.
Okay, thank you. Next question. Is it okay for women to nurse if they received the vaccine or are sick with COVID?
That's a really good
Oh, okay.
question. I'm not sure if I can adequately answer that question, but absolutely for vaccine, there's no reason why you could absolutely be vaccinated. Let me say in a positive light, you can absolutely be vaccinated if you are a woman of childbearing age, if you are currently pregnant, or if you're currently breastfeeding. So there's no consideration, concern, or issue. And in fact, women who are pregnant or recently pregnant have much higher risks of severe illness, hospitalizations, and a much higher rate of complications. So we'd highly encourage women who are pregnant or breastfeeding to be vaccinated to protect themselves and their infant, because children under the age of 5 can't yet be vaccinated. As far as can COVID disease, is how I heard the question, can COVID disease, if you're infected with COVID, can you breastfeed during that time period? I don't know that I can answer that question today. I can take that back, but that's a really complex question that I think I would defer to your medical provider. I've not heard that there's any reason why you couldn't, but I would defer to your obstetrician on that one, or your gynecologist.
Okay. And our next question is it safe to get multiple vaccinations, for instance, J&J and then Moderna, etc.?
That's a really good question. And thanks for bringing that forward. There are actually some really terrific studies done about if you received one product as your primary series, your first doses, and then you later had a different brand for a booster. There are some really great studies that talk about how good of an immune response we make. So the recommendation would be, if you get a 2-dose series, we want to stick with the same brand, the first dose and the second dose ideally. But if you don't have a choice and you can't get that brand that you originally had, it's okay. to go ahead and finish the series with whatever brand's available. Now, for the booster information I was talking about in that scenario, they actually find that that there's quite a great and wonderful immune response. It's a little bit higher or better if you switch from one to the other. Specifically, if someone were to have the J&J vaccine as their primary series and then were boosted later, they seem to respond very, very well to the Pfizer and Moderna vaccine and create a little bit better immune response. And it was similarly seen for the other vaccines. If you used a different brand, it was as good as or a little bit better. So when it comes to that boosting, we can mix and match. Now, Moderna and J&J are only approved for individuals 18 and older. So we could only mix and match for people who are 18 and older for boosters. I hope that ends the recommendation. There's a lot of caveats.
A lot to keep track of.
Yes.
So I think you answered this question to a degree earlier, but she's asking about her children, I think, in particular. The question is, my family caught COVID. We all got our shots, but my kids need to get the boosters. When should they get it since we just got COVID? Do we wait 3 months or get it sooner?
Great question. I would say if it were me and my family, I would definitely try to seek vaccination as soon as everyone's feeling well. After your isolation time period, you've come out of isolation, you're healthy and safe enough to go out into the community. So at that point, you could be vaccinated as soon as that time period for anyone 5 and older. So I would highly encourage it because we know that you're making a strong immune response when you have COVID illness. But we know people who are vaccinated also have a really wonderful complementary response when you add vaccine to illness. Now, it's not wrong to wait a little bit. Like I mentioned before, you probably have some immunity that's going to last for a couple of months. So it wouldn't be wrong to wait or defer or delay vaccination for a few months, maybe 3 months, up to 3 months, but I probably wouldn't delay. I would probably go in to be vaccinated sooner than later to really start making a strong immune response, especially in light of Omicron with how effective it can be. And we know no vaccine is perfect. We know vaccines, we know breakthrough cases can still happen, but we know that we have that protection from severe outcomes like hospitalizations, being on a ventilator, or possibly passing on.
Right. Okay. Oh, we'll see what you do with this question.
Uh-oh.
If a child is unvaccinated and gets COVID, how long do they need to isolate?
Sure, I would just refer or defer to the CDC guidelines for quarantine and isolation. If they're unvaccinated, there's certainly a table in the CDC guidance that states if you're unvaccinated, I think the isolation time period is still that 10 days, but they have been shortening it for those who are vaccinated or boosted. So for unvaccinated, I would defer to that CDC table on guidance for quarantine and isolation.
I know my 3-year-old granddaughter got COVID unvaccinated because she can't be vaccinated.
Right.
And they held her in quarantine for the full 10 days just because she was unvaccinated to begin with. So I don't know if that's the same for everybody or not. Okay, next question. I received my booster last Thursday. I had a mild reaction. I tested positive yesterday, and I was sent home from work at an IHS facility. Talking with family, I heard from a few more people who tested positive after receiving the booster. What do you think about that?
Sure. This is a question that's come up since the beginning of when the vaccine was available. And the question really is, can you have a positive test because you've been vaccinated? And the answer is no. The vaccine can stimulate an immune response in your body, but it wouldn't show as a positive COVID test ever. So it's more likely that you got your booster, you were feeling, a little under the weather for a day or two was very normal. Body aches, chills, fever, fatigue, headache, tiredness for 1 to 2 days is normal. But you could have already been exposed to COVID. And it takes about 14 days to make a good, strong immune response after vaccination. So we want to give our body that time to make a full immune response. I'll tell you something that happened to me last year in December 2020. I was so very excited, to get my very first dose of vaccine. However, about a week later, I was exposed to and got COVID. My body didn't have enough time to make a big, strong immune response. So I was susceptible. Similar case in this situation. We know your primary series offered you some really wonderful protection, but over time it declines with how strong of an immune response we have and how infective this new Omicron variant is. So likely you were exposed to the Omicron around the same time that you were boosted, and probably it just unfortunately happened at the same time, but the vaccine can't cause a positive COVID test.
Okay. And I think this question is similar to the children who, these children were vaccinated, but were due for boosters and caught COVID. And they're wondering if they need to wait 90 days before they get the booster.
Great question. I would encourage you to go in as soon as you can. It's hard to get a family in and coordinate the days and the times and the hours and the appointments. I would encourage you to go sooner than later to know you have that protection. Your body's making that natural immune response, but we can help it out by also adding in vaccination, and that can help prevent from more severe illness. We don't know how many times you could get COVID. Theoretically, you could get it multiple times. And I know people who've had it 2 times. So we'd want you to have the maximum protection. I don't know personally if I would wait the full 90 days, but I certainly probably would seek vaccination sooner than later once I'm feeling well enough after COVID disease or illness.
Okay, and then someone was just asking if it's, has anybody noticed it enough that they can measure, or how common is it after receiving the 3rd booster vax that people would get COVID? Does it seem to be a common occurrence or rare?
Great question. So in the time of Delta, which was a little more than a month ago, during the Delta time period, we knew breakthrough infections will always occur because not everyone responds perfectly to the vaccine. We know some people are our elders and they may not make as strong of an immune response. Some people take medications or have illnesses or diseases that make them not make as strong of an immune response. And so what happens is in those situations, we want to make sure that I'm sorry, I think I've lost my train of thought. Can you repeat the question one more time?
Yeah. Do we know how common it is? Is it
common? It is, thank you.
Or not?
I'm gonna say, I know I'm going down that train somewhere. So yeah. It was about 10% at the time with Delta. About 10% of cases were breakthrough cases, meaning you were fully vaccinated, you were totally up to date with your recommendations at that time. And about 10% of people would still get COVID because we know no vaccine is perfect or 100%. Mm-hmm. With Omicron, we're seeing a lot more breakthrough cases, that's for sure. We know that for the most part, people are getting just mildly ill, not a lot of severe disease, not a lot of hospitalizations if you've been vaccinated. So I don't know if it's quantified yet. I know that the CDC expert, Dr. Fauci and others have spoken to the how well the boosters offer protection with Omicron. And originally they said there's like a reduction from about, it was a 33% coverage, but if you got your booster, you were protected up to like 80%. So it was a significant jump if you have your booster for how much protection that booster offers. And I think that data is still evolving. It's definitely coming in hot and heavy every day as we collect more information and learn more about the Omicron variant, but the booster definitely is protective. But again, it doesn't mean you could never get COVID, but if you did, we know that you're less likely to have severe outcomes, more likely just to have a mild flu-like illness, body aches, chills, fever, feeling under the weather for a few days.
And so the question is, once you get COVID, can you get it again right away, or does it look like a few months later, maybe when the immunity is waning?
I think that's
Sure.
that's exactly the point, Chief Cook, is that with COVID, can you get it again immediately? Probably not, but we can't say that definitively. Everybody's body is different with how their body responds to illness and infection and vaccination. But we would think that you have about 90 days of your own built up immunity in your body to protect you from getting infection again. Now, it's all new with Omicron, so we don't know that for sure. That was true the last year or so, but in the last month, everything has changed, it seems.
Yeah. And the question is about long haulers and how they may be affected. I'm not sure if they're asking about long haulers in relation to Omicron infections as opposed to what we were used to with Delta and the previous variant or previous virus.
I don't know if we have any information on that quite yet, or if, does Omicron cause long haulers? I don't know if we've had enough time, because it's been less than a month in our country, that we would know. I would tell you that there was some what they call anecdotal evidence, which is like not in a clinical trial, but people were reporting that if they were a COVID long hauler and then subsequently were vaccinated, they tended to improve faster and had more controllable symptoms. They stopped having as severe long-term symptoms. So that was something that came forward maybe about, I don't know, 5 or 6 months ago. I haven't looked into that any further, but that is definitely a topic of great interest. There are so many people that are COVID long haulers. So you talk with your medical provider. I would definitely encourage vaccination, because there is no reason why you couldn't be vaccinated. And if there's a chance it could help to improve your symptoms of long COVID, that would be great. Ideal would be just simply not getting COVID and being fully protected and never getting the disease. But that's not really seeming to be very easy in our current status.
Next question. What does it mean when you can still test positive after 90 days of it? I guess it's past the 90 days from infection. Does it mean we still have a detectable viral load, but very low levels after we have recovered from COVID? And how long have you seen someone who had COVID get reinfected? Thank you.
So that's a really unique scenario. And we've had a few patients in that situation too, where they continuously tested positive for COVID for long periods after they had their initial infection. And they were immunosuppressed patients. I don't know the answer on that, quite honestly. The best thing to do would be to talk with your medical provider and do there are certain kinds of tests, or rapid tests, and there are PCR tests and certain kinds of tests that you and your provider can talk about that might be best to detect whether you have the virus in your body or not. because if we're looking at immune response, some of those tests kind of have some crossover. So I would want to make sure that you talk with your provider, talk with the laboratory specialist, and that you're doing tests that are detecting the actual virus, and not just like a rapid test too. And then the latter part of that question, can you repeat that very last sentence?
Yeah, does it mean how, and how long have you seen someone who had COVID get reinfected? Thank you.
Um,
I don't know if it's how long after.
how long after? Yeah, maybe.
Have you seen
Yeah,
someone?
theoretically, I mean, I've heard of people getting reinfected several months after having an initial COVID disease, but that's just hearsay and what they call anecdotal. I don't have any evidence about that. So, I mean, theoretically, if you have a low immune system because you take a medication or you have a certain illness that lowers your lowers your immunity, then you could be more susceptible to getting it again in a shorter time frame.
Okay. Next question, is IHS giving boosters for 12 to 17-year-olds?
Absolutely. Definitely check in with your local site. They're doing some really great things to expand hours, days, times. I know at my site, we have expanded hours to allow kids to come in after school. We're hosting some events on weekends. One of our sites was hosting it like on some of the federal holidays when they knew that a lot of kids would be out of school and would have a greater opportunity to come in and be vaccinated. So it's really exciting that our sites have been so flexible in trying to get folks in. Every site is different. So I don't know what days or times the clinic might be open in your area, but I would certainly give a call over there and ask. Some sites have COVID clinics where they run it constantly. I know at my site, we have it Monday through Friday, every day, and we were packed full every day. And we get, I don't know, over 100 families per day that we see. And a lot of times it's complicated because a lot of folks want to come in and get everybody up to date at the same time. So we might have a grandmother coming in for her booster, the mom coming in for her second dose, and then the kids all coming in for their first. So we have a lot of variation. Sometimes just be patient because everyone has so many different needs. And many of our sites are offering flu vaccine or fully updating your child on the full vaccinations, which is really exciting. I know that at 11 to 12-year-olds need several different vaccines for based on the CDC recommendations and for school. And then at 16 is another age where they need some routine vaccinations. So if we can cover all that you need in those walk-in clinics, great. If you can attend one of the community vaccination events, wonderful. Otherwise, just schedule a regular appointment and they'll get you in and get you everything you need to. So every site is a little different, but we're trying to go to extreme lengths to make it convenient for families to bring in everyone to be updated.
All righty. Next part of the question was, I read a study that talked about once you get a booster shot, it can take up to 10 weeks before you are covered. Is this true?
That's a really great question. So we know with the concepts of how our immune system work and vaccines in general, it typically takes about 2 weeks before you have a good immune response. Now there's certainly the short-term immunity that your body makes, and then there are long-term memory cells that take a little bit longer to build and make. So for you to be fully protected, we say that's 2 weeks after vaccination, but your body is so amazing and our immune systems are so intricate that they have a lot of different mechanisms to make short-term and long-term memory. So it's definitely a continuous process in our bodies, and it could see how the long-term immunity might take it does take at times a little bit longer to fully build up to its full potential. But that doesn't mean it's not still very effective after 2 weeks or so.
Okay. And this again, how long after you caught COVID do you continue to test positive?
Usually, not for very long. Usually only in your experience, Chief Cook, I don't know if you have anything to lend to this one, but normally people only test positive during that, 5 to 10 days of isolation, depends. And there are new guidelines saying if you're a healthcare provider and there's a certain situation, and if you want to have a negative test before returning to work or to your community. So, and then mask wearing for those additional days to complete that full 10 days.
Can you explain a little bit about the difference between the rapid test and the PCR test and how one might give you a positive result for a longer period of time than the other might?
I am not the expert on testing. Maybe you have something to lend to this one. There are differences for sure. There are different rates of what they call sensitivity and specificity, which are the rate of a true negative, the rate of a true positive. Could there be, false negative and false positive? These tests are pretty reliable, but there are different tests that test whether you've made an immune response, or there's other tests that test the longevity of immunity. And then there are other tests that test whether the virus is detected physically in your body at this moment. So I would encourage you to talk maybe to your medical provider and laboratory specialists to gather more information about what tests might be best for you, depending on your scenario.
And can you speak a little bit to when you were talking about grouping immunizations together? I know some moms get wary of giving, 3 different shots, 5 different vaccinations in these different shots. How the body accommodates all of that, or how that isn't a problem for, young children or babies to be immunized.
Sure, that is such an amazing question. And, this has been, there's some really great resources from the CDC and the American Academy of Pediatrics. And the reality is our immune systems are amazing. And even an infant, even a little tiny baby who has a very immature immune system has the theoretical capacity to respond to over 10,000 vaccines in a day, which is crazy when we think about it. So our immune systems are just so amazing. We've been exposed to all kinds of disease and illness over the millennia, where we might be exposed to something we eat, something we breathe, something we drink, or something we're exposed to on our skin. And our body has amazing ability to create an immune response. So that question has been asked many times, do these vaccines overwhelm our immune system? And the answer is no. Our bodies might take a few days to mount up a good immune response. And so you might feel yucky for a few days. You might have a little fever. That's pretty normal, especially after childhood vaccines, especially in the 2-month vaccines. They might have a low-grade fever. They might be a little more fussy. We might feel under the weather or fatigued or just feel a little under the weather while our body makes those immune responses, but it is not overwhelming the body. We actually recommend at the 1-year-old age point, you can get 7 vaccines that have multiple components inside of some of them. Like you can get the MMR, the varicella, the DTaP, which has 3 different pieces in there. The MMR has 3 pieces. The varicella has 1. You can get all these things on the same day, and that's okay. We have data to show that it's safe, that you make it just as strong of an immune response, and it's okay. And sometimes it's so convenient to do all the vaccines in one day everyone has the best intentions. Oh, we'll come back next week. But sometimes it's so easy to put it off and put it off and put it off. And then we end up behind on vaccines when sometimes these are really critical time points, especially for our babies. We bring them back at the 2, 4, and 6 month, and then 1 year age points, and a few more after that. And it's really critical. A couple weeks could make a really big difference for a child being susceptible to illness.
Thank you. What are your thoughts on encouraging our tribal communities to get vaccinated and boosted when data seems to show that more vaccinated people are positive for COVID these days as opposed to unvaccinated individuals? I'm not sure that's accurate.
I'm not sure if that's accurate either. And it's hard to know at this point, right? Because we know that depending on which age group you're looking at, about 70% of our country is fully vaccinated. So, or it has at least 1 dose and it's moving up. And it depends on the age group. If we look at our 65 and older versus our younger age groups, the percent vaccinated varies. But I do think it's something, I don't think people who are vaccinated are more susceptible. I don't think the data shows that. I think that we know that people who are vaccinated are not having as many severe complications, which is what I think is the most important thing. Our rate of death and dying, if we look in our hospitals, those people who are having the severe complications are those who are unvaccinated. So I don't think it could be any more clear with the data on that. It's incredibly high percentage, like 95% and upwards are people who are unvaccinated, who are otherwise young and healthy. They're people in their 20s, 30s, and 40s right now. It's no longer the situation for elders getting a lot of disease and dying. It's more the folks in their 20s, 30s, and 40s who are unvaccinated. At the same point, there was a question in there that had to do with how can we get our tribal communities to be more accepting of vaccinations and boosters. And I think it's really using our trusted messengers, utilizing our tribal leaders and tribal leadership, our respected individuals, our native language speakers, the medicine men, those folks who are traditional healers, those folks who believe in the vaccine and they believe that this is a tool to help people come through this pandemic. And it's not perfect. We absolutely know that. We're clearly seeing that vaccination doesn't mean you could never get COVID. It just would mean that it's moving and transitioning from this thing called a pandemic to more what they call endemic, which means it's more common in our communities. For example, in 1918 with the flu pandemic, it took about 2 years. We saw a lot of death, dying, and illness that you could see in graphs and all these historical depictions of what happened during the 1918 flu pandemic. But a couple of years later, our bodies had seen it, we had exposure to it, and then it became less severe to our bodies because we had some snapshot of it before we had some exposure. So it's probably doing the same here with COVID, is what's being discussed is as moving from a pandemic to more endemic, or being part of a natural in our communities, natural exposure in our communities. So we can do our best, and that's to vaccinate, masks, hand hygiene, stay away from gatherings at this point, and do our best to try to reduce transmission.
Lately, they've been talking about how the surge in the Omicron has been such a sharp rise, and they're anticipating that there's going to be a sharp fall, or they've at least seen it in other countries. Do you know what accounts for that precipitous fall that they're thinking might happen, as opposed to the flattening the curve phenomena that we've experienced before?
I don't. And I think that's really interesting. I heard that the other day too. And I thought, I wonder what precipitates that. Like, what brings that forward? How does that happen? How does natural infection, immunity, vaccination, all these pieces, how do they play in? I don't know the answer to that. That's a
Mm.
really great question, and I hope one day we can answer that.
Yeah,
I would
yeah.
love to see a precipitous decline, that's for sure. Many of the healthcare staff are exhausted, overwhelmed, working excessive hours, on the tail end of nearly 2 years of this pandemic, with greater demand for vaccinations, testing, and all these other items. And so I think our healthcare workers would love to see a precipitous decline.
Right.
I don't know if that will
I
happen.
really hope.
Yeah, I've heard CDC mention the other day, likely continued rise, with starting to see a fall mid to late February, and maybe resolution of the spike in March. So it doesn't sound very fast to me, but I agree. I did hear that, I think in the South African countries.
The question, let me just try to go back here. Oh, somebody answered the previous question we had, where the person thought that there were more. Okay, let me try it back. I'm trying to cut into the middle of the question. To get vaccinated and boosted, when data seems to show that more vaccinated people are positive for COVID as opposed to unvaccinated individuals. And then another participant has addressed that and said the data actually shows the opposite. The positive case counts are higher for the unvaccinated, which is what you had also said.
Which is what I would believe, but I can't say that I have a graph in my head or a particular study to point to at this time. So,
right. I don't know if there's any other questions. Let's see. I think we talked about the boosters for children ages 12 to 15, right?
Right. So they are recommended. Everyone should is the language. Everyone should be vaccinated or boosted if you're 12 or older. That it was recommended for the 16 to 17-year-olds to be boosted for a while already, but it said you may vaccinate with a booster for the 16 to 17-year-olds. And more recently, last week, they came out clarifying and strengthening the recommendation, saying that everyone 12 and older should be boosted. Of course, the Pfizer vaccine is the only vaccine that's approved for anyone less than 18. So only the Pfizer vaccine would be used for both the primary series and or a booster for those 12 and older. 12 to 17, that is.
All right. Well, I think. All right. I think we have one more question.
Okay.
What is the recommendation for someone who gets COVID when they're, I think they're saying when there are updates? What's the recommendation for someone who gets COVID?
If they're already up to date on their vaccines, including primary and booster.
Mm-hmm.
That's a really great question. And that is happening around our country right now. People who've been fully vaccinated and boosted, there is still that potential to get COVID. It can happen. You just want to follow the CDC guidance for quarantine and isolation. So regardless of vaccine status, if you test positive, you want to stay home for 5 days. If you have no symptoms or your symptoms resolve after 5 days, you can leave your house, but you'd want to wear a mask for the 5 additional days and really try to limit your exposure to the community. If you have a fever, you definitely would not want to be exiting your home. You'd want to stay home and try to keep away from community members or even family members to reduce the risk for transmission. So it's really difficult. I mean, I live in a multi-generational home as well. My parents live with me. And I have smaller children. Phew, they're getting big now. I have a 9 and 12-year-old, and it's difficult. I try to sit across the room. Even though my parents live in my own home, I try to sit across the room every day. When I talk with them, I don't feel like I can be close.
Right.
And it's a struggle, and it's awkward, and it's difficult. And when I was working in the hospital every day, I didn't even feel like I could sit on the couch with my own children for so long. And it's really impacted our daily lives and our relationships. Still spend the quality time, but maybe not the closing the gap on the distance still. Just because my family, I want to make sure my elders and my family are well protected. And so I think that's something, it's so much more than just me or us, right? It's our community, it's our family, it's our elders. And just considering those pieces, because when I mentioned that I had COVID in 2020, the thing that was most concerning to me was the fear. It's the fear of, who did I expose when I didn't even know I was sick?
Right.
Who could I have, who may be in the hospital or have a severe outcome because I didn't even know I was sick and I wasn't being cautious. Thankfully, it didn't pass beyond our family. It was my little child who brought it in. We didn't know. It's just one of those reality moments where the fear for transmitting it is just terrible. We lost my uncle for a similar situation, multi-generational home. One of the kids brought it in. He didn't make it. So it can be really overwhelming, and how devastating for family members to feel like they brought this into their home. So it's overwhelming.
We're really running short. So there was a question about the KN95 and the KF94 masks, if there's a difference, and what is the difference? I don't know if you know. I don't.
I don't. I mean, I just know what little bit of research I've done on my own, but I would say I would defer to the CDC expertise and guidance on that. I did see a question pop in about if you're fully vaccinated and boosted and you're exposed to someone who had COVID-19, what can you do? So I popped in the recommendations from the CDC. If you've been boosted, they say you're right. You don't necessarily have to quarantine. You would wear a mask around others for 10 days and then test on day 5. That's what the CDC guidance says. I would defer you to there because it's constantly changing and I don't want to misspeak.
Right. Well, thank you so much. We've come to the end of our time and you did a great job answering all the questions. I want to thank everyone for joining us, and to all of you who shared your questions during this session. Please feel free to email us with additional comments or concerns after the listening session at bgallagher@nihb.org. And I think her address is also in the chat. And again, thank you for your time, and please stay safe. Thank you, Dr. Ben Wu. It was enjoyable moderating this session with you.
Thanks, Chief Cook. I really appreciate it. And I'm not an expert on everything. I tried my best.
None of us are.
So many questions from so many different arenas, but we tried our best. And please just encourage you to get vaccinated and ask more questions. If you're not sure, talk to your pharmacist, talk to your medical provider, ask more questions because we're there to help. That's what we do all day long. So please ask.
Okay. Thank you, everyone, for joining.